Hello and welcome back to another video by the Rose System. My name is Sarah and today we will be going into brief detail on what Dissociative Identity Disorder or DID is. This is the first video of our Dissociative Disorders Rundown series. This video does not replace proper research into DID and should not be used as a source. I am not an expert and my knowledge is limited. Let's get into it. DID is a complex disorder that forms in early childhood due to repeated and/or severe trauma. For many systems, this trauma includes ongoing abuse. Everyone starts off with an unintegrated personality. This is why children can go from sad to happy in the blink of an eye. When severe trauma occurs at an early age, a child's brain can put up dissociative barriers to cope with the trauma. When the personality integrates around the ages of 7 to 9, the dissociative barriers prevent the personality to form into one, but will instead form into two or more. These multiple personalities are referred to as alters. Each alter has their own identity, thoughts, feelings, and desires. They are each unique individuals and should be treated as such. There are 5 criteria a person must meet to be diagnosed with DID. These are laid out in the DSM-5 under the code 300.14. The DSM-5 is the current manual on mental health disorders. A. Disruption of identity characterized by 2 or more distinct personality states, which may be described in some cultures as an experience of possession. The disruption of marked discontinuity in sense of self and sense of agency, accompanied by related alterations in affect, behavior, consciousness, memory, perception, cognition, and/or sensory motor functioning. These signs and symptoms may be observed by others or reported by the individual. B. Recurrent gaps in the recall of everyday events, important personal information, and/or traumatic events that are inconsistent with ordinary forgetting. C. The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. D. The disturbance is not a normal part of a broadly accepted cultural or religious practice. Note: in children, the symptoms are not better explained by imaginary playmates or other fantasy play. E. The symptoms are not attributable to the psychological effects of a substance or another medical condition. It is common for DID systems to have comorbid disorders. Every system will experience PTSD and/or CPTSD. Other common comorbid disorders are depression, anxiety, bipolar disorders, psychotic disorders, personality disorders, and addiction. Other disorders can be comorbid too, however these are the most common. It is estimated that 1 to 3% of the population has DID, which is about the same percentage of people who have red hair. About 6% of DID systems are overt systems where switching can be noticeable. The vast majority of systems are covert, where switching is not as noticeable. DID is formed to be a hidden disorder, so many systems instinctively hide. The host, who is the alter who fronts the most, is generally kept unaware that they have DID. Psychotherapy or talk therapy is the main method of treating DID, and many systems report improvements through talk therapy. This can include helping the system learn grounding and safety interventions. For many systems, the aim of talk therapy is to reach integrated functioning, where the system works together as a team and seeks harmony. Full integration or final fusion is when the dissociative barriers between alters go down and the alters combine, forming one alter. Final fusion can be the goal for some systems. However, it is not necessary for healing and in some cases it can cause further damage. There is no medication for DID, but antidepressants and psychiatric medications can be used to treat comorbid disorders and can be helpful for the system. The recovery journey for each system will be different. What is helpful for one system won't be helpful for another. If you would like to learn more about DID, I have placed a link in the description below. It goes into further detail and has further sources for you to check out. Thank you for watching this quick rundown of DID. Please know you are loved by the incredible God of the universe, and I will see you in the next video.